mynews.studio.
In 2026, a single dose of donated antibiotic can mean the difference between sight and blindness. But by 2030, will we really see the end of trachoma?
Today's date is February 20th, 2026. The numbers around trachoma are striking. Back in 2002, 1.5 billion people were at risk. By 2025, that number had dropped to just over 97 million. That's a 94% reduction. What actually led to such a massive shift?
The main driver is what's called the SAFE strategy. That stands for surgery, antibiotics, facial cleanliness, and environmental improvements. Each part addresses a different factor in the disease's spread. But what really stands out is how tailored the approach has been. Take Ethiopia, for example.
Sorry, just to clarify, Ethiopia's approach involved focusing on women, right?
Exactly. In Ethiopia, women are almost twice as likely as men to need surgery, mostly because of their caregiving roles. So interventions there specifically targeted women. 70% of those receiving surgery were female.
Ethiopia's still a hotspot, isn't it? In 2024, they performed almost 3/4 of global trachoma surgeries and delivered 73% of antibiotics. That's a remarkable concentration in one country. Why is Ethiopia so central in this effort?
It comes down to population. Ethiopia has the largest at-risk group, about 66 million people in trachoma endemic areas. The geography is challenging too. Lots of rural communities, which complicate logistics. The key has been relying on community health workers and local partnerships to reach even the most remote areas. Adapting to local contexts has really been essential.
What about outside Africa? For instance, how did they manage to reach isolated communities in parts of the Americas?
In those cases, mobile health teams played a big role. Partnerships with local leaders helped too. Community education campaigns were important for raising awareness, and mobile clinics provided antibiotics and surgeries to villages that would have been hard to reach otherwise.
Let's dig into antibiotics for a moment. Pfizer, through the International Trachoma Initiative, has donated over 1.1 billion doses of azithromycin. That's not just a donation, it's a huge logistical operation. How did these medicine donations help break down barriers?
Donated medicine removed one of the biggest costs. That freed up national programs to focus on delivery. Things like infrastructure, training, and collecting data. Instead of worrying about buying antibiotics, it made mass drug administration possible in more than 40 countries.
But the fight isn't over yet. There's still a $300 million funding gap for the final push. Surgeries, more antibiotics, surveys, and research. Still, the value of donated medicine so far is more than $2.2 billion.
That's right. And the mapping projects have played a huge part in targeting resources. The Global Trachoma Mapping Project and Tropical Data Initiatives have surveyed millions of people since 2012. They've allowed governments to direct interventions to the places they're needed most.
So that's the data side. But there's a human side too. Health workers in tough environments, people regaining their sight. It's more than statistics.
Absolutely. Behind every data point is a person. What's encouraging is that countries like Egypt, Fiji, and Libya have shown progress is possible, even in difficult circumstances. Libya, for example, eliminated trachoma as a public health problem in 2026, despite ongoing political instability.
Do you think the way trachoma has been tackled could be a blueprint for fighting other diseases? What lessons can we draw?
The approach, coordinated action, data-driven decisions, public and private partnerships has already helped eliminate at least one neglected tropical disease in 58 countries. The global goal is 100 countries by 2030. What we've learned from trachoma is already spreading to other health challenges.
So it isn't just about one disease, but about showing how the world can tackle bigger health threats, if there's enough coordination and commitment.
And the story of trachoma shows that when science, communities, and global collaboration come together, diseases that once seemed unbeatable can be brought close to elimination.
That's the big picture. From 1.5 billion at risk down to under 100 million in just over 2 decades. The finish line is in sight, but it's going to take sustained effort to get there.
Thank you for following the story of trachoma with us. It's a case study in what's possible when science, community, and collaboration work together.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.